We performed a stress test on you to determine your risk of having a type of heart disease called coronary artery disease. This disease is suspected when poor diet, lack of exercise, and increased genetic risk is associated with symptoms like chest pain and shortness of breath. High cholesterol is another very large risk factor for this disease. Because you've been having chest pain, we evaluated your risk for this by giving you the stress test. Your test results are based off your blood pressure and your heart rhythm during the test, and also any symptoms you may have experienced. Because of your results, we suspect you might be at risk for CAD. This means that you have a blockage in your arteries that prevents blood from flowing to your heart muscle. It's usually caused by fatty deposits that stick to the walls of your arteries and eventually cause a blockage. Although the stress test may indicate a risk for CAD, it's not absolute. For this reason, we recommend that you undergo a procedure called a cardiac catheterization and angiogram. This test will actually allow us to look at your blood vessels around your heart and see if there are any blockages or buildup of fatty plaque that could be reducing your blood flow. If there are any blockages, we can fix them.
So, what does this procedure entail?
The first thing we do for the procedure is we put you to sleep under anesthesia. Once you're asleep, we're going to drape you with a big sterile drape, and we're going to clean off the incision site with some soap. Afterwards, we'll make a small incision in your groin, and we'll use that to gain access to your femoral artery. This is important because all your arteries are connected. So what we can do is insert a catheter into your femoral artery and feed it up your aorta and into the blood vessels that surround your heart. We can look for a blockage in your heart by using that catheter.
So how are you able to see what you're doing in all of this?
That's a good question. You'll be laying on a big table, and this table is surrounded by a huge machine. And what it does is it takes pictures of the inside of your body. It's called fluoroscopy. It's a type of x-ray machine that shows us a live video feed. So what we'll be looking at, you can really see your bones very well and your muscles very well on the x-ray. But we need to see your blood vessels. So in order to do that, we have to fill the catheter and your blood vessels with a type of contrast. This will highlight the blood vessels on the image so that we can see clearly what we're doing.
So how are you able to see that I've got a blockage?
So with the contrast, it's going to highlight all of your vessels. If the vessels are constricted in a certain area or dilated in another, or just don't in general look right, then we can tell that there's a blockage or something else going on.
So what do you do if you're going to see this blockage?
So when this happens, we'll use a thin flexible tube catheter with a balloon at the end. So we'll insert that and feed it all the way up to the vein or the artery that we saw had the blockage. Once we get it there, we'll use the balloon and we'll inflate it several times to widen your arterial walls. That allows more blood to be pushed through. After we do that a few times, just to increase the diameter of the walls, we'll thread in a small stent through a catheter. That stent will be deployed all the way up to where the blockage is. And when it reaches the blockage, we'll release it. When we release it, that stent expands, and what it's going to do is hold your artery walls open so that you can get blood flow to the rest of your heart.
So what if that doesn't work?
In the event that we can't get the stent in or the balloon and we just can't get past the blockage, you might need a different procedure called a coronary artery bypass graft. If this does occur, then we'll have to schedule that another day.
So what are the risks to all of this? There's a lot here.
As with any invasive procedure, there's always a risk of infection or bleeding or swelling at the incision site. There's also a risk that the blocked artery could rupture when we put the balloon or the stent in. And then after the procedure, there's an increased risk of stroke. However, we will take all the necessary precautions and preventative measures to avoid these things from happening.
So what happens when this is all over?
So after the procedure is over, you'll probably spend some time in the hospital on observation just to make sure that you're okay afterwards. And then you'll have to remain on certain medications to prevent blood clots. And we also recommend a change in diet and exercise.